All right, just momentarily, we're just going to take you somewhere in Tehran, I believe, in one of its main medical centers. The reason why we're doing this is we're in the middle of seeing the moment that one of the Iranian health officials, I believe, is receiving actually, it is in the third clinical trial of the first Iranian COVID-19 vaccine by the name of coviran. This is the first Iranian vaccine. It is, however, it is in its third clinical trial. Just a few moments ago, the lady that you see in the white gown there, she is Dr. Minu Mohras. She is the top Iranian immunologist. She received the vaccine herself like she did in the first two trials. We didn't air that for you because we were in the middle of a news report. But the gentleman that you see placing himself on that chair is the second person to receive this vaccine today. Of course, it is not just any vaccine because of the situation of these days, you know, how important it is for countries to get their hands on any kind of COVID-19 vaccine, let alone that being an internally developed one, domestically developed one for that matter, as that gentleman is preparing. The moment arrives for him to receive another jab of this COVID-19 vaccine by the name of coviran. And of course, hopefully, it will lead to mass production in the later stages. Let me just remind you, coviran, the one that you see its trial right now, is not the only one that has been developed by Iranian scientists. We have, if I'm not mistaken, at least 2 other vaccines that have been either developed or are in their final stages or in some stage within the process of their preparation for mass production and public use. Of course, as the jab was received by that gentleman there, right now they're trying to check his heartbeat to see if it's normal and to actually release him to go. And, well, there you have it. That's the trial of the third trial of the first Iranian COVID-19 vaccine by the name of coviran. I do sincerely hope that this is going to lead to not only the betterment of the public health that is sometimes in a critical situation. It has its ups and downs recently. So has been the case in so many countries because of the number of people who unfortunately get the disease these days. And that is why the hope is that this will lead to a success and thereby it will be something that the country can rely on, maybe hopefully in the later days or later weeks. It will be the help of some other regional countries. Who knows, maybe that's going to be prepared for export as well. But for now, I guess the focus must be on the fact that it should become available. And let me see if we have translation provided for this. If not, I'm just going to get back to you. Let's take a listen.
This will be one of the best in the world. Probably, the reporters asked me, how do you know that this vaccine will be one of the best in the world? I said that, God willing, this vaccine will hit the market and you will see. In phase 2, even in phase 2, I said that I had volunteered to take part in phase 2, but they didn't accept. And then I said that I would participate in phase 3 of the clinical trial of this vaccine. And this is, our people should believe that our elite and scientists, when they accept to do something, they will try their utmost to produce the best result. We hope that based on the promises that we have received by officials, we will be able to mass produce this vaccine as soon as possible so that we won't need to import any. And this juncture, this is a coronavirus vaccine. We should reach a level where we we won't need other countries' help for any disease. We have a lot of sworn enemies. Maybe later on we will face another disease, so we should be able to stand on our own feet when it comes to vaccine production.
Well, there you have it. That was the head of the Health Commission in Iranian Parliament, Mr. Shahriari there, the second person to receive that COVID-19 jab. Mind you, like I said, this is the third clinical trial of the first domestically developed Iranian COVID-19 vaccine. And of course, you heard for yourself some hopeful words for the public as well as the media who were present there to basically report that scene to you and I. And I believe the third person is trying to take a position. I'm not really sure who that is, but of course, symbolically, some officials that have to do with the health issues of the Iranian public will be the first ones to receive the jab in a gesture to show everybody that it is safe and that the officials are the first ones to receive the jab themselves and before actually prescribing it for any member of the general public. Again, this is a ceremony that is held and marking the third clinical trial of the first domestically developed COVID-19 vaccine. The person that you see there, probably one of the top Iranian scientists in the field of medicine. She's an immunologist by the name of Dr. Minu Mohraz, a first in many areas, including immunology, mind you, and that the nurse or the technician that you see right, they're trying to take that vaccine into the syringe right in front of the cameras in order to show that this is the same bottle and the same syringe with the same contents, just to actually showing enough proof that they are doing something with the same name and that the person who's just about to receive that jab is being inoculated with that same syringe. So let me just again mention that as you're watching this, and you know it's self-explanatory, I don't need to tell you what's happening here. Let me just tell you this is the first one, true, but we have, actually Iran has two other COVID-19 vaccines. They are also in their clinical trials. We are actually getting updates on them as well. And as soon as we know, or we have, relative images to that, we're going to show them to you as well. That is, well, the less important, a very important issue. Of course, the most important part of it is that both for the Iranian public and for people of the world, no matter where these vaccines come from, it's comforting. It is good because, everybody is in stress these days because the number of COVID-19 patients are getting more and more by the day. You have countries in Latin America, you have countries in Europe, you have, for example, Iran that has seen its own fourth round of surge these days. And of course, you have India. Some of these countries are involved in preparing their own vaccine, but some are not. Iran, for one, is. But there are so many other countries that are seeing a surge, and perhaps, unfortunately, a surge in the number of not only the people who contract the disease, but people who lose their lives too. So that is obviously good news to see scenes like this and to perhaps wait and pray for the success of those scientists and their product, what they actually come out for the sake of humanity. Let's all pray for that. That's a very good moment, a happy one. Let's just hope that that's going to work and perhaps, get to this stage of mass production.